Dr. Rosenblum.
Welcome. It's March 31st, 2020, and I'm doing the format a little different today. I'm actually videoing this podcast. Since the COVID crisis, I've had a little bit more free time, unfortunately. Now, I don't know how long it's going to last because I do have my colleagues who are running into the burning building at the hospital, residents, attendings who are intubating these patients, and to be honest, it's insanely scary what they're doing, and I'm just waiting for that call because there is a chance that pain physicians like myself may be drafted to the hospitals, either to go into the operating room or cover airways or PACU, which is now an ICU, as well as our ASCs, which are now ICUs. So a lot's happened in New York, and I'd like to take this moment to make you think of New York sort of as, it's not that we're New York, capital of the world, we know everything and you don't know. It's more like we're a few weeks ahead of you, and therefore you might just want to pay attention to what's going on here. Of course, New York is a very different animal than other places in the country. In some ways, it's worse because of the congestion with respect to the virus. But in some ways, we may have more resources, actually, because we're close to the water. The naval hospital is coming. The floating hospital, I heard, is getting set up in the city. And so in some cases, we may be at a disadvantage. In other cases, we may be at an advantage. So everybody has a different situation. But I wanted to take a moment to just give you a little crystal ball as to what's happening, what could happen where you live, and let you know what's going on. First of all, with respect to our societies, Aspen put on a great webinar last week. And there's another one coming up on April 2nd. Check out their website. You can register for the webinars if you're not getting the emails already. In addition, I've been asked by NICEP to help out with the marketing of the upcoming webinar, and I've been working with Ed Rubin, Sudhir Dewan, Chris Garibo, Ken Chapman, and Brian Durkin to put this out along with Michelle Byers and her team. And one of the thoughts that was brought up by one of the docs on the committee was, a year from now, you might be getting commercials or hearing commercials on your way to work, something like this. Have you or a loved one been injured by an epidural steroid injection during the COVID crisis? Epidural steroid injections can possibly worsen the outcome for patients infected with COVID. You may be entitled to compensation. Or another advertisement saying, have you or a loved one gone into withdrawal or been neglected in your treatment due to a physician refusing to give you opiate medications or other palliative medications during the COVID crisis? The economy is obviously taking a big hit, and a lot of these lawyers may be looking for new work, and maybe they're getting bored with the mesothelioma. So just keep that in mind. Now, that being said, I'm doing a few cases a week, not much, and I'm screening the patients. In fact, I had to cancel a patient the other day because she was wheelchair bound and too heavy to lift in my office. We don't have the AmSurge Center now. Our AmSurge Center at the hospital is being turned into an ICU, as I mentioned. And my staff or myself getting close enough to actually lift a patient onto the bed did not make sense. First of all, if the patient's too old, it's a major risk to them, right? Elderly patients with COVID, but still. I think that it's imperative that we screen our patients adequately. We also explain to them the risk of the epidural steroid injection, which is not completely known. It's not like we have concrete data on this. There supposedly is a risk to giving steroids to these patients. But in terms of epidural steroid injections, I still don't have the final verdict. And I'm not going to, I guess, ruin the surprise of what the NICEP committee will talk about the webinar. So I'll leave that to them and focus more on the reporting as to what's going on here and how you can best prepare for what's going on in your neck of the woods. Now, we are getting some lots of requests for volunteers, and as I can imagine, you are as well. I have friends who are anesthesiologists and currently not working, and they're thinking about volunteering. Of course, people are apprehensive due to the risk, and it is a significant risk. It's not something that, unfortunately, is so easy necessarily to do. when you have a family, especially when you're older. When the residents and the attendings were talking about who should be doing the floor intubations, it's a big controversy. I mean, some institutions, I think it's the attendings, others it's the residents, and there's different points of on both sides. Of course, nobody wants to do it, but at the end of the day, the younger, healthier people who would probably tolerate the virus better are the residents, but the more experienced people may be the attendings. They may not be, right? The attendings, I haven't intubated in over a year, so maybe, it could be a experienced resident. So I think it's a very individual thing, and I don't think the burden should lie on just one particular group. So that being said, I have here the quarantine regulations just released by New York State. And first of all, they recommend people who are exposed to or recovering from COVID to work in the workplace setting if needed to maintain essential services such as medical services and whatnot. They include, but not limited to, healthcare personnel, utility and water operators, skilled manufacturers, I guess the guys making us the masks, and supporting supply chains, transportation, infrastructure, law enforcement, emergency response personnel, essentials who have been exposed to a confirmed case of COVID can be permitted to work in the required workplace setting if all of the following conditions are met, and they list them as such. They're working from home that would not be feasible for job duties. The personnel are asymptomatic. They personally quarantine themselves when not at work. They're also undergoing temperature monitoring and symptom checks upon arrival to work, and at least every 12 hours while working, and self-monitoring. Of note, we did check a temperature before a shot yesterday, and the patient was 99.7. When I went to cancel it, she said, "I have a hot hat on, try again, please." And we tried again, it was 98.7, so. Personnel required to interact with individuals within 6 feet should wear a face mask while working for 14 days after the last exposure. Personnel whose job duties permit a separation of greater than 6 feet should have environmental controls in place. And this is to ensure adequate separation. Now, they do not need to wear a face mask if they have that. If a person develops symptoms consistent with COVID-19, such as fever or shortness of breath, while working, they should immediately stop and isolate themselves at home. Testing will be arranged for any personnel with symptoms. And essential personnel with confirmed or suspected COVID-19 can be permitted to work in the required workplace settings. And this is if all of the following conditions are met. And this is, once again, set by New York State. May be different in your state and may be changed over time. Working from home would adversely impact essential services or functions, including critical health, public works, infrastructure in New York State, or the response to COVID-19. Personnel have maintained isolation for at least 7 days after illness onset, so after the symptoms started. And they have not had a fever for at least 72 hours without the use of antipyretics or fever-reducing medications. And with other symptoms that are improving, the personnel who are recovering from COVID-19, according to the above conditions, must wear a face mask for 14 days following the onset of illness. Protocols for the essential personnel to return to work following COVID-19 exposure or infection. For the purpose of guidance, a face mask is a well-secured mask that covers the mouth and nose. No personal fit testing is necessary for the face mask, and of note, that's why I was tempted to go the grunge look and not shave during this crisis, but I figured I'm going to be wearing face masks, and it's probably not a good idea to grow a little beard because it may allow air to get into the mask. And you could check out the New York State's website, and I just read that to you from their last notification. So of note, this may be coming to your town or your city, and I do hope that you guys are taking this very serious. There are people starting to die, and it's not really it's something that it's very tempting to have play dates with your kids and do things, but I don't think it's a good idea. Maybe if they're quarantined, you're quarantined for 14 days. If you trust them enough, maybe it might be acceptable, but I don't want to give any advice with respect to doing that because social isolation does appear to be the safest thing. In addition, there's going to be a lot more of this at the NICEP webinar. I strongly recommend that you guys check it out, even if you're not from New York. By the way, NICEP is New York State Interventional Pain Physicians Association. So you should really check it out because we are, unfortunately, I guess, the COVID capital of America right now. And yeah, that's not a lot of fun. It looks like that movie, if you ever saw Vanilla Sky with Tom Cruise, where all of Times Square is empty. It's like that. The streets here are pretty dead. I've never seen it like that. It feels like every day here is New Year's Day with all the stores closed and whatnot. But check it out. I think you're going to find it quite interesting. We have excellent speakers. I know them personally, and I'm sure you've heard them speak at a lot of the national meetings such as NANS and ASIP. They're quality people and will strive to bring you value above and beyond what you expect, as well as they are aware of what's covered in the other webinars, so they are going to try to make this more unique. So once again, if you have any questions about board prep, please contact me. Otherwise, contact the boards. There are delays in some of the board exams right now, so just make sure you're aware of that. And I do have plans to bring a nutritionist on to help us maximize our nutrition, as well as a naturopathic physician who can give us the best advice in terms of the herbal medications to protect our immune system and keep us healthy. So please check back with us for the next podcast. In addition, my ultrasound course, April 26th, is being delayed. I am making modifications in which we'll postpone it to May or June. So if you are interested, we're either going to do a full Sunday or possibly a half a day on the webinar and another half day in person with a model, but we'll have social distancing precautions in place. Even if it's on the downslope of this curve, I don't want anyone getting sick at any of my events. It's not worth it. It's completely not worth it. So once again, I wish you all the best. I hope that you share the podcast and videos with your colleagues, as well as stay safe. If you're going back to the operating room or the floors for intubations, gown up and be careful. And one last piece of closing advice. If you happen to do what I did and give your children haircuts, make sure you do it in the bathtub. Don't do it outside. Even if you use a towel or some other sheet to cover them, they'll still bring hair in the house. It's just not worth it. Do it in the bathtub. Don't make a mess, and you'll be a lot happier. Take care.
Dr. Rosenblum is here solely to educate, and you are solely responsible for all your decisions and actions in response to any information contained herein. These podcasts are not intended as a substitute for the medical advice of a physician to a particular patient or specific ailment. You should regularly consult a physician in matters relating to yours or another's health. You understand that this podcast is not intended as a substitute for consultation with a licensed medical professional. Copyright 2017, David Rosenblum. All rights reserved. No part of this publication may be reproduced, stored in a retrieval system, or transmitted in any form or by any means, electronic, mechanical, recording, or otherwise, without the prior written